Welcome, and thank you for choosing Dr. Bill Robertson for your orthopedic care. Before your surgery, let's go over some important preoperative instructions. First, make sure to follow the fasting guidelines provided by your healthcare team. Remember to avoid eating or drinking anything after midnight. Secondly, double-check your arrival time at the hospital and plan to arrive early to complete any necessary paperwork. Lastly, wear comfortable clothing and leave any valuables at home. These steps will help ensure a smooth and successful surgery experience. If you have any questions, don't hesitate to ask your healthcare provider. Let's get you prepared for a successful procedure. When preparing for surgery, you'll want to ensure you have surgical soap on hand. If you don't already have it, head to one of our office locations to pick some up. Alternatively, you can find it at CVS or Walgreens. It is called Hibiclens. The night before your surgery, make sure to rinse the affected limb with half of the soap. Then, on the morning of the surgery, use the remaining half of the soap to rinse the affected limb. This step is crucial for maintaining cleanliness and reducing the risk of infection. So, be sure to follow these instructions carefully to ensure a successful surgical outcome. Before your surgery, remember not to eat or drink anything after midnight the night before. If your surgery is scheduled for the afternoon, avoid consuming any food or drinks within 8 hours of the procedure. It's important to steer clear of tobacco products, nicotine pouches, gum, and candy. On the morning of your surgery, feel free to brush your teeth, but be cautious not to swallow any significant amount of water. These restrictions are crucial to ensure a successful and safe surgical experience. Your cooperation in following these guidelines is greatly appreciated. As you prepare for surgery, it's important to follow specific instructions regarding GLP-1 medications, as their use is becoming much more common. Some examples of these medications are listed here. If you are not using these medications, then please disregard this slide. If you are, then please cease these injections 1 to 2 weeks in advance of your surgery. Additionally, for 24 hours before the surgery, stick to a clear liquid diet and avoid solid foods. Remember to stop all liquids 8 hours before the surgery. After the surgery, you can resume your injections as usual. Before your surgery, it's important to prepare by adjusting your medications. If you usually take medications in the morning, remember to stop them on the day of surgery unless a surgery nurse advises otherwise. Additionally, halt all vitamins and supplements on the morning of your surgery. Avoid anti-inflammatory medications such as Aleve, Advil, and ibuprofen for 3 to 5 days leading up to your procedure. If you are currently on a blood thinner, it's crucial to consult your cardiologist or PCP for guidance on when to stop this medication before your surgery. As a surgical patient, Dr. Robertson may enroll you in an outcomes database to help track your progress. If enrolled, you will receive an email, text message, or both a few days prior to your surgery. To access the survey, all you will need is your date of birth. No passwords are required. Please take a few minutes to complete all the questions and surveys before your surgical day. Once completed, you will receive a No Further Tasks message. After enrollment, you will continue to receive similar surveys at specific post-op time points, such as 3, 6, and 12 months. This allows us to track your progress and compare it to your preoperative status, as well as other patients with similar conditions. Your participation in these surveys greatly assists us in providing you with the best care possible. Before your surgery, it's important that you avoid using razors to shave the area where the surgery will take place. The nursing staff will shave any needed areas prior to your surgery. Also, remember to take off any finger or toenail polish. Don't forget to remove any piercings or jewelry as well. If your medical condition changes, or you start running a fever with a temperature higher than 101 degrees Fahrenheit, make sure to reach out to our office at 817-419-0303. These steps are crucial to ensure a smooth and successful surgery process. Your cooperation in following these guidelines is greatly appreciated. Thank you for your time, and we look forward to getting you on the road to recovery.